Good evening, my name is Allie and I will be demonstrating how to start an IV today. The first thing I would do before starting an IV is check the order for the patient to receive one. Then I would gather all of my supplies needed to start the IV, and then I would head towards my patient's room. Once in the room, I would perform my hand hygiene and my proper PPE as needed. From there, I will identify the patient, identify myself, and instruct the patient on what I would be performing. From there, I would look at the arm to see if there's a good vein that I could use to start the IV. I'd palpate it, make sure that it's good, and it'd be an easy stick. From there, I would down my gloves and begin to assemble my materials. To start the IV, I have my J-loop, my needle, my flush, and the IV start kit. I would first prime my flush. Then I would attach it to the J-loop. Okay. From there, I would open my IV, my needle, and open and set up all of my supplies for the IV. From there, I would apply the tourniquet snugly around the patient's arm, about 3 to 4 inches above the vein that I will be doing. And then I would continue to palpate, making sure that I can feel the vein and it is a good one to start an IV with. From there, I would use an alcohol swab or the chlorhex stick to cleanse the patient's skin of any bacteria. After I've done that, I will let that dry. Once it is dry, I can no longer touch that area. I would then pull the skin taut and begin to start my IV. I would make sure that is my bevel up. I would instruct the patient there's a big stick coming and to take a deep breath. And as they exhale, I would stick the patient 1, 2, and 3 at a 10 to 15 degree needle angle. And then as I see the flashback or the blood return, I would advance the catheter into the patient's arm. Okay. But before removing the needle, I would take one of my pads, my gauze, and I'd place it right underneath. Okay. And then I would hold the catheter, making sure that it would not slip out, and remove the needle and discard it into the sharps. From there, I would quickly attach my J-loop to the IV, removing the band, and then I would flush it, making sure that it is good to go. And then from there, I would remove my flush. Okay. Then I would take my Band-Aid and I would apply it to the site right before the J-loop drain. I would attach it together, and then I would date, time, and initial the tape and place it onto the IV. From there, I would clean up all of my supplies, make sure the patient is not in any distress, and perform hand hygiene.